death of actor Sidharth Shukla is obviously shocking. But why such kind of cardiac issues are coming up in young generation? He was just 40. To explain all this, we have Dr. Tapan Ghose, who is Director Cardiology in Fortis Vasant Kunj. Dr. Ghose, it is shocking for you, but you must getting patients like this to who came for consultation and all. What do you think could be the cause of death in this Sidharth case?
It's shocking news, and we are really shocked at this news. And these deaths, which we call premature heart disease, that means heart disease occurring in the young, is not unknown. It is quite common in India. And if you look into the deaths worldwide, 75% of the deaths which are premature, that means less than 60 years of age, occurs in Asian, Indians, or emerging economies. Now, Asian Indians are 4 times at risk of heart disease, which is 20 times more than the Japanese population, very high risk. And we could identify 9 risk factors as per the Interheart study. That 9 risk factor could explain why it occurs in prematurely in Asian Indians, and these are high cholesterol, high blood pressure, diabetes, lack of exercise, abdominal obesity, stress, and other factors. Now, if you go by the data, we are at higher risk. Why at higher risk? Western population, they get heart disease at 63, mean age is 63. But our population get at 53. That means they get heart disease 10 years earlier. So we cannot use their data, their yardstick for the prevention in Indian population. And our patients with heart disease have bad cholesterol, which is more than 100, as compared to their cholesterol level. Bad cholesterol level is more than 130. So for us to get a heart disease, we get at a lower level of all the risk factors. So, and every day we lose 900 patients who are less than 40 years of age in India, who are dying every day. So, although it's shocking news, but it is not unknown.
And why at such an early age? 40 is a quite early age, and he was looking quite fit. He is doing fine, everything was normal, but suddenly this news came. What could be the possible reasons?
The possible reasons are, not that, if you look fit, you are fit. I think that's a myth. And one should, go by the medical history, the family history of heart disease, the risk factors like diabetes, hypertension, smoking, high cholesterol level, ApoB, A and B1 ratio, and then look at the life, cycle. Whether the person is sleeping for at least 7 hours a day, whether he is sleeping less than 6 hours or more than 9 hours, because we know that less than 6 hours sleep or more than 9 hours sleep is a risk factor for vascular disease. So a person should sleep for 6 to 7 hours. Then does he have adequate exercise daily? Then the vitamin D level in the population should be checked. Like if many people we see in India that their vitamin D level is 3, 4, 5 nanogram per ml, very low. And this is an emerging risk factor. That means people are recognizing that this could be a very important risk factor in Asian Indians. Even our own data has shown that first heart attack is quite common if the vitamin D level is very, very low. So young age means that we should look for many factors which could explain the heart disease.
And even competition is one of the factors, if you can reckon with, because he was a Bigg Boss winner, he was doing good, he is doing professionally well, but there must be a thrive to be on the top. So could you reckon that as a possible reason?
Yes, you have pointed out a very important risk factor. So we know that if a person is type A personality, that means he's trying to think or project himself or trying to achieve the best. He's the first boy of the class. He wants to be the best. He wants to be the winner. These type of personality, he has a time urgency. He wants to go fast, right in time. 8:30 means 8:30, time urgency. So these persons are called type A personality, and this itself is a risk factor for having heart disease. And other risk factor is a type D personality. If the person is depressed and has a negative personality, he thinks that nothing can happen, my life is gone, I'm doomed. Those people who has got a negative tendency, again at a higher risk. And I'm sure he was at the type A personality, and of course this is also a important factor.
And is there, without any alarm, this heart attack comes, what we are learning, that without any alarm. So these kind of attacks are common, which are coming without alarm. You get no chance to recover or to get admitted in hospital.
This is called sudden cardiac arrest, and heart attack comes without alarm. That is called acute myocardial infarction. And this sudden cardiac death is a very important factor, because 1/3 of the heart attacks becomes a sudden cardiac death. So this is an eye opener for everyone. First thing, we should have some contingency plan. Suppose I collapse, then my friend should be able to do CPR. Like if I collapse now, you should be able to do CPR and take me to the nearest emergency. That's very important. So population, education for CPR, cardiopulmonary resuscitation, basic life support should be taught people in the population. Secondly, we should know and identify beforehand. Suppose somebody collapses, where we are going to take him. That should be identified, and every household, everyone should be knowing that in case of medical emergency, where should you rush. That there should be always a contingency plan. Third thing, if a person has a central chest pain, then one would like to administer aspirin half tablet, chew, and then take him to the nearest hospital, do a ECG, and proceed for angiography, angioplasty, whatever is required in that case. So practically speaking, these things are always sudden, and sudden death can be prevented if we apply a risk factor concept in the population. Like, whole population should be, identified, blood pressure should be identified, diabetes should be identified, that should be treated, cholesterol level should be treated. If you treat these risk factors in the population, then only we would be able to reduce the, level of sudden cardiac death in the population. Of course, lifestyle changes, as you just said, lifestyle changes are very important. There is the personality A or type D that should be modified. We should have a psychological consultation, intervention with a clinical psychologist, so that your stress management is done, which is very important for the prevention of sudden cardiac death.
Definitely, and prevention is one of the mechanisms by which we can save precious lives, like Sidharth Shukla as well. And that's why the news is really shocking for everyone, for lakhs of his fans as well. But there is a lesson in it, and we should look for the lessons which we can learn with this case of death of Sidharth Shukla. With camera person Premchand Mishra, it's Kumar Kunal for India Today from Delhi.